Hello friends, myself Dr.vrushali. Today we will discuss about the easy pharmacology. In this easy pharmacology lessons, we will discuss today's topic is routes of administration. Routes of administration of a drug that depends upon the characteristics of drug. Certain drugs that can be administered only the parenteral routes, whether other drugs can be administered by oral routes and all. Second characteristic depends upon the age of the patient. In pediatric groups, we preferably use the syrup or suspension form of drugs. Otherwise, and in other group of the patients, we preferably use solid form of the drugs. Third one is an emergency condition. In emergency conditions, we usually prefer the parenteral route of administration. And another is condition of the patients, like patients who have vomitings, diarrhea. In that patients, we preferably again use the parenteral route of drug administration. And of course, the last one is a doctor's choice. Some doctors preferably use parenteral drugs, or some others preferably other oral or other routes of administrations. Now we will discuss about the classification of route of administration of the drugs. Hmm. It divides into the two parts, that is local route of administration, and second one is an systemic route of administration. Systemic route of administration of the drug that again get divided into the three parts, that is enteral route of administration, then parenteral, and the last is an others. An enteral route of drug administration that includes the oral drug, that is an oral tablets, oral pills, like then sublingual route of administration that includes the sublingual form of the drugs like tablet, nifedipine and all. And rectal, that is a rectal suppository. And parenteral route of drug administration that includes the intramuscular, intradermal, subcutaneous and intravenous route of administration, and others that includes in that inhalational form of the drug administrations. And the last is a transdermal patch in the transdermal steroid patches, transdermal diclofenac patches for sustained release of the drug. Uh, Now, in the part one of this route of drug administration, today we will discuss about the local route of administration. Local route of administration that again is in the three forms, that is topical. Second one is an intra-arterial injection of the drugs that is preferably used for the coronary angiography, that is again one of the form of local drug administration. And third one is a deep tissue injection. This deep tissue injection is again a local form of drug administration. In that cases, the injection is to be intra-articular injections. That means injections into the joints, that is preferably used for the joint pain. Now, in the topical route of drug administration, that is depends upon the site. In oral cavity, that is lignocaine spray, 10% lignocaine spray preferably used for the tooth extraction. This is one of the form of the local route of drug administration. And then the skin, in the skin, various skin infections. In that we use the skin lotions, ointments, creams and all. And in eye drops, various ear drops for various eye ear infection, even in the post-operative patients. This is one of the also a one of topical form. And then again the vaginal pessaries, and then in GI cases, local antiseptic neomycin for particularly in ulcerative colitis patients is again in local form. This is also one of the topical route of drug administration. Thank you. That is all about the local form of drug administration. In the next part, we will discuss about the systemic route of drug administration. Thanks you.